Hi, and welcome back. So now I want to talk about bladder health and how the pelvic therapist gets involved in rehab when there is an issue with the urinary system, which is a very common thing that women deal with. They oftentimes have different periods of their lives where there's some sort of bladder dysfunction. So the first thing I want to just kind of give you an overview of, or a little bit of education on, is how our urinary system works. So in general terms, we have the kidneys that produce our urine, and that urine travels down the ureters, or tubes, to enter the vessel that is the bladder. That bladder is a holder of urine and a storer of urine. And as that bladder or that vessel gets full, it has muscular walls. So the bladder is in essence a muscle. A lot of people don't realize that. So as the walls or that muscle stretches to fill with urine and it's full, the stretch receptors in that muscle send a signal to the brain, I'm full. And then you walk to the toilet, you sit down, you relax your pelvic floor. Remember that I said those sphincters need to be able to relax to open, and the bladder contracts and pushes that urine out. If you have normal urinary mechanics, you should never have to push your urine out. You should be able to sit on the toilet and relax, and it should come out appropriately. If that's not happening, there could be some reasons behind that, aside from just having a tight pelvic floor, which many women do. It could be because you're not allowing that bladder to fill enough during the day. Remember, the best way that the bladder can empty is when there's pressure on the walls from that fluid in the bladder. So if there's enough pressure, then you're going to have a nice strong urine stream. If there's not, and you're going every 15 minutes or a half hour, then you might not have a strong urine stream. So what is normal? What's normal or good bladder health? If you have good bladder health and your bladder and your urinary system are functioning normally, you should be peeing every 3 to 4 hours. We do sometimes say 2 to 4 hours is okay, depending on how much fluid you're taking in. But if you're taking in adequate amounts of fluid, you should have to go every 3 to 4 hours. If you don't, then you need to increase your fluid intake, preferably in the form of water. If you're drinking your fluid and you're going more often than every 2 hours, then there's probably a little bit of dysfunction there that needs to be addressed. It's normal to go to the bathroom between 6 and 9 times in 24 hours. So if you are going more than that, then there's something that needs to be addressed. And there's some of those things you can do on your own at home. You do not need a pelvic therapist for. Some of them may need a little bit more intervention. And then if you are waking up in the middle of the night, that's not normal. Many times as women get older after menopause and they lose estrogen, there is an increase in what we call nocturia, which is going to the bathroom in the middle of the night. But it should not be more than 1 time a night in the middle of the night. If you're waking up more than that, one of the really easy things that you can do during the day without the help of me being in the room with you is to start what we call bladder retraining. Bladder retraining helps to work with your autonomic nervous system, which we touched upon with that deep diaphragmatic breathing, which can really help with urinary frequency and urgency. But it also can help with the relaxation of the muscles and so on. So I want to go back up a little bit though and talk about the different types of problems that women can deal with. So we talked about urinary retention a little bit in the first session, and that's just that you aren't able to empty your bladder completely. And that could be because of a couple of things. It could be because we talked about how the muscles or the sphincters are too tight. They can't relax enough to allow the bladder to empty. It could be because you're not allowing your bladder to fill enough to get the pressure on the walls to be able to contract and push all that pee out. And the other reason why you could have urinary retention is if that bladder is normally sitting here, if it drops back a little bit into that vaginal canal, now you have a little bowl or a little piece of that bladder that's holding extra urine. So as the bladder is contracting and pushing the pee out here, you get up and then a little bit more sloshes forward. You didn't empty it completely. And we can help that with some other techniques, like trying to splint or give yourself a little bit of pressure to make sure that you empty completely, standing up and sitting back down and voiding a little bit more to make sure that you've gotten everything out. Those are some things that you can do for urinary retention. One of the biggest things that I hear about is urinary incontinence and or urinary urgency and frequency. So urinary incontinence, as I said, is usually caused from some sort of sphincter dysfunction, but it can be because the sphincter is too tight, as just as often as it can be because the sphincter's not, it's completely lax. It's not contracting at all. If a muscle is so tight, if it's in a holding pattern, it's not going to be able to contract anymore, right? So if my bicep is stuck like this, I can't really do much with it, right? So it needs to be able to relax and contract appropriately all the way. So urinary urgency and frequency is a major concern for women who have lost estrogen, and oftentimes that happens with breast cancer treatments and things like that. So the urinary frequency can be aided with this bladder retraining. And what you want to do is you want to start, maybe keep a bladder log. So you're going to look at, okay, I pee every hour from the time I wake up to the time I go to bed. If you write down the amount that you eat, that you take in, the amount of fluid that you take in, if you are going to the bathroom and the time that you go to the bathroom, how much of an urge you had when you went to the bathroom. Is it a 1, which is a small urge, you just went just in case? Is it a 2, which is a moderate urge? Or is it a 3, I'm running to the bathroom? And then if there was any urinary leakage on any of those episodes. So if you do that for a few days, you can kind of get a pattern as to how much you're voiding. And then from there, what you can say is, okay, I go to the bathroom every hour. I'm going to try to push it to every hour and 15 minutes. True bladder retraining is going to the bathroom on a timed schedule, whether you have to or not. What that does is it teaches your bladder that I'm going to empty you, but I'm going to empty you when on my time and not just when you're misbehaving. So you're teaching your nervous system to calm down by holding back. By holding back, we call that urge control. So in between those sessions of an hour and 15 minutes, let's say, you are trying to, if you get an urge to go to the bathroom, you're going to sit down, you're going to stand quietly or sit, you're going to take a couple of deep breaths, maybe do a couple of squeezes or Kegels, and which we're going to talk about in a couple of minutes, and try to shut that bladder off and wait until the urge subsides. You are never to run to the bathroom with an extremely strong urge. It is not normal to have an urge that is that strong and that sudden. Urge incontinence or urgency occurs typically in response to a trigger. Those common triggers might be running water or arriving home, putting the key in the door, trying to get to the bathroom. You didn't have to go to the bathroom 10 minutes ago, but now you have to rush there right now because your bladder is doing this, it's contracting, and you think, I can beat this, I can beat this, I can beat this. The problem with that is if you don't stop your bladder from contracting, you will never beat it, and you have to take control over it. People look at me like I'm nuts when I tell them this, but you do have control over it. You just have to take control of it consistently. Other things that can contribute to urinary urgency is having a habit of going to the bathroom just in case. So if you don't have urgency yet and maybe just a little bit of frequency, you need to look at your bladder health. And that's one of those, like I said, is taking in adequate amounts of water. So you want to be, believe it or not, water does not make you leak or go to the bathroom more often. It actually can help to stretch the bladder and help you go less often. So you want to drink at least 2 liters of water a day, which is 6 to 8 cups. You need to sip on those cups all the time, rather than downing a large amount at one time. You should not be going to the bathroom just in case ever. So if you're in the habit of going to the bathroom before you leave work and you just went an hour earlier, you don't really have to go. You need to tell yourself, no, I don't have a full bladder. I'm not going to go to the bathroom. I can make it 20 minutes home. Going to the bathroom just in case is only okay if you are going to do a vigorous workout, exercise routine, or if you're going to be traveling in a car or a plane. Those are the only times I allow my patients to go to the bathroom just in case. So those are really important techniques. The other thing that you can do is you can try to look at your diet. So dietary irritants can contribute considerably to urinary urgency and frequency. And so we try to avoid any kind of dietary irritants, and oftentimes that's pretty much everything that we drink. A lot of people will avoid drinking water because they think they're going to leak urine or pee more, but they're drinking their coffee, they're having their wine at night, they're eating their spicy foods or their citrus, and no, that's not causing my bladder to be irritated. But there are a lot of things, including dairy. There are a lot of things that are irritating to our digestive systems that are irritating to our urinary systems too. So what I tell people to do is first take out the obvious. So carbonated beverages, coffee, tea, even decaffeinated coffee and tea can be irritating, and dairy and alcohol. And so you can play around with that and see what you're most sensitive to. And some of those things you may be more sensitive to, some of those things you may be not. But if your diet consists mostly of dietary irritants, you need to change that and you need to replace most of that with water. And that's a really important thing. So that's bladder health. So if we have urgency and frequency, you're going to do your bladder retraining and you're going to utilize your urge control or urge deference techniques. Another thing on urge control that I want to point out that's really important is that urge control isn't just getting control over the urge before you get out of the car to go get into the house. Because I can tell my patients, all right, you know that you're going to have an urge to go pee when you get home, so you can anticipate that that's going to happen before you even get out of the car. And you can stop and say, I have control, I'm going to take a couple deep breaths, I'm not going to race to the bathroom. You can literally talk to yourself. You can talk your bladder down. It really does work. And stay there. But when I say you should never race to the bathroom with a strong urge to pee, I mean that consistently. So a lot of times people will say, well, I did really good. I got control over the urge, and then I thought, I really do feel like I need to go. So I started to walk normally to the bathroom, and then it came back again, and I couldn't rip my pants off fast enough. And I tell them that's because you still jumped at that toilet while your bladder was misbehaving. So sometimes I'll say, if you get into the bathroom and that urge comes back, you need to stop, even if you have to close your eyes and not look at that toilet, and squeeze and hold and take a couple deep breaths or whatever it is and get control over it before you get there. It's going to be a challenge. Some people will still have accidents, but the more you do that, the easier it's going to be to control it. Another thing I like to tell people when it comes to urgency and frequency is to not pee in the shower. And that's a very common thing that people do. They get into that warm water, they feel like they have to pee and they just let it go. But what you're doing is you're training your nervous system to have to go to the bathroom every time water runs. So we don't want to do that. That's a bad habit. If you're teaching your kids to do that now, you need to stop. If you're running the water so they can pee, you need to stop. That means that they probably don't have to pee, okay? So those are really important techniques for bladder health. Let's talk a little bit about the other type of incontinence or bladder dysfunction, which is stress incontinence. So we have urge incontinence, which is in response to an urge, but then we have stress incontinence. And this is a very, very common type of involuntary loss of urine. And I use the term incontinence, and people will say, well, I'm not incontinent, I just leak once in a while. Incontinence is any involuntary loss of urine. So it could be drops or it can be a large amount of urine. With urge incontinence, because the bladder muscle is contracting, we can lose our entire bladders full of urine. With stress incontinence, it doesn't usually occur like that. It's usually like a cough or a sneeze, and you get a little squirt here and there. Sometimes the two of them can combine. So sometimes the sphincters at the bottom of the bladder or in the pelvic floor are not functioning properly. And so when that pressure goes down to the bottom of the canister, remember I talked about the canister in the form of air in the pelvic cavity, it causes the bladder then to get an urge and the bladder can contract. So you can have a combination of stress and urge incontinence. So let's talk a little bit more in detail about that. So stress incontinence is when you have that involuntary loss of urine in response to a stress trigger, a physical stress trigger, not a stress trigger, okay? And so the physical stress trigger is usually any kind of pressure, again, going down to the bottom of that canister and pushing down on that bladder, okay? That makes sense, right? And so that can happen with a cough, where you're pushing down, or a sneeze, or a laugh, where you're letting your belly muscles go and you're just bearing down. Remember that as the belly fills with air, the pelvic floor drops down, so that as the belly's filling with air, it's already dropping down and you're pushing down even further, okay? And that's what happens when there's sphincter dysfunction. But the other thing that can cause stress incontinence is any pressure directly on the bladder this way too, if there's problems with the sphincters down at the bottom of the canister. So what we want to do to combat stress incontinence is we want to learn how to close the bottom of that canister off and not let that pressure go down towards that bladder. So when you cough or sneeze or laugh, what you can do is you can engage all of the muscles around the canister, including your abdominal muscles, and not let that excursion happen when you're doing the cough and sneeze. So for example, if I cough and I don't hold it back anything, what can happen is my stomach pushes out, right? Now, if I hold, and I'm not sucking in a lot, I'm just kind of just doing a gentle tension, that canister, and I cough, you're not seeing my hands move as much because I'm bracing. Does not require a lot of effort. It's just a gentle bracing that can really stop that pressure going down from the bottom of the canister. Another cue that helps a lot of people is thinking about like imagine there's a piston, a hydraulic piston inside your canister or your abdominal cavity. If the piston drops down, everything opens and you pee and you poop, right? So we want to just gently hold that piston afloat and kind of turn the car idling on a little bit higher so that you provide that support and that sphincter control to be able to control that stress incontinence. So the other thing, which I'm sure you guys are all waiting for, is that you can do exercises that can combat the stress incontinence and teach you how to contract and relax those muscles, and those are Kegel exercises. So what I try to instruct my patients in is that Kegel exercises are not just for strengthening. They are for mind-body awareness, and you need to do a Kegel exercise in both directions. So that means when you squeeze the muscle, when you actually contract the muscle, it moves up and into the pelvis. So it's moving up towards the head when you squeeze. And when you relax, it drops down towards the floor. Okay, so up and down. Most of the movement occurs, remember I said it's kind of like a cross. It goes front to back and side to side. The center of that cross is right at the perineal body, the area between the vagina and the anus. That's where you'll see like a little lift. Most of the movement occur when you do a proper Kegel. When you do a Kegel exercise, you also need to relax it completely, and you should be able to feel both extremes. So the muscle can contract, relax, and bear down. So you need to be able to do all three of those things in order for the muscle to be functioning properly. So Kegel exercise program, I generally will have people start in a very moderate range. So there's different types of doing Kegels, but what I usually tell people is start about 2 to 3 sets of 10 a day of Kegels. If you're doing a Kegel properly, nobody should know you're doing it. So if your buttocks muscles, your stomach muscles are squeezing, you're pulling your knees together, that's not normal and they should not be activating. We are learning to isolate just these tiny muscles in the pelvic floor, and they are pretty little, okay? So if you do the exercise in isolation, then you can really learn to feel it, and then you can grab those muscles when you need them in response to a cough or a sneeze. You can actually activate them pretty well. So again, this is not just about strengthening, it's about learning how to find them properly so then you can activate them when you need them. So what you're going to do is for the Kegel exercise, I want you to sit up nice and straight for me, or it's really probably a good place to be is to sit up. So if you can sit up, and we're going to get started, and uncross your legs and get yourself in a comfortable position. And I want you to think about the muscles down at the bottom at your seat, okay? And they should be nice and relaxed. And remember, they're sitting between those sits bones, up a little bit, and between the sits bones, not on the outsides of them where your buttocks muscles are. And they surround the vagina and the urethra, okay? So imagine that cross going front to back and side to side, and the center of that cross being that perineal body between the vagina and the anus. You're going to think about drawing those 4 points of the cross together into the center, and then like a drawstring bag, you're going to draw them up. And you're going to hold for 3 to 5 seconds, and you're going to relax completely for 3 to 5 seconds. And that's the Kegel program. 2 sets or 3 sets of 10 a day, 3 to 5 second hold, and then relax for the same amount of time that you contract. The other cue that I like to use that works beautifully, that I love, is imagine you're picking up a blueberry with your vagina. So the blueberry is a really great fruit because it's small and it's easy to crush, right? So you don't want to crush it because if you squeeze too hard, you're going to pull in all those extra muscles and you're not going to be isolating it and they're not going to be as helpful. So you want to be thinking about just gently scooping up that little blueberry and holding it. And then when you relax, you want to drop it completely. And that's a nice little cue that you can try that might help you isolate a little bit better. So I think I've completed everything with bladder health that I wanted to go through with you. So our next class will be on bowel health. Thank you.